Hello everybody, welcome to our next module. In this module we're going to be talking about a couple of specific chronic conditions, cardiovascular disease and cancer. The first thing I want to do is have you review the structures and function of the cardiovascular system at this crash course link. One of the things I think is so important to understand about the cardiovascular system is the way that it interacts with pretty much every other important system. It's a part of the peripheral nervous system, meaning it's not under voluntary conscious control. The cardiovascular system directly interacts with the respiratory system and ensures that oxygen is delivered to the body in the blood, and that blood depleted of oxygen returns through the heart and lungs, with blood making a full circuit of the body every 20 seconds or so. The cardiovascular system also allows us to distribute the fuel and nourishment from the digestive system through our bodies, transport hormones from the endocrine system to regulate our bodily functions and provide feedback to the brain, and transport various immune cells through our body so they can provide us with defense against antigens. The heart has to pump blood with a great amount of force or energy, in large part to overcome the impact of gravity, because we're sending oxygenated blood up to our brain and other organs that are above our heart. So we have to overcome the force of gravity for that blood to travel up. We also send oxygenated blood down through our abdomen, to our legs, down to our feet, and the heart also has to be able to ensure that that blood, once it goes through the oxygen exchange, can be transported back up the legs, back up the abdomen, back to the heart and lungs to be re-oxygenated, once again having to overcome the force of gravity. So the ability of the heart to exert a great amount of force is essential to keeping circulatory system function going well. Problems with cardiovascular disease, or CVD, affect the heart and blood vessel system and are so pervasive in our society. Some of the most common CVDs are stroke and coronary heart disease, or a chronic disease in which the arteries that supply the heart become narrow or clogged. Here you can see a comparison of a healthy heart with a picture of a heart of someone who has suffered from cardiovascular disease. And you can see a big difference, suggesting the diseased heart is not able to function as effectively, as it becomes less flexible, more rigid, and less healthy. Because the heart is itself a muscle, it requires blood supply just like any other part of the body. There are two primary arteries that supply oxygenated blood to the heart itself, and those are called the coronary arteries. Plaques, or deposits in the arteries made up of cholesterol and other types of fats, connective tissue, and muscle tissue, that grow over time and that actually calcify or harden into a really rigid bony substance that thickens the walls of the arteries, can form within the coronary arteries and decrease the blood flow or circulation to the heart itself. This overall process is known as atherosclerosis, which is one of the primary forms of CVD. The formation of plaques can be harmful themselves, such as by causing coronary artery disease when blood clots form around the plaques and reduce the blood and thus oxygen that can get to the heart. Over time, this can lead to coronary heart disease where the heart has been damaged as a result of insufficient blood supply. Plaques can also be quite problematic if they rupture and then travel through the bloodstream, meaning a plaque buildup can lead to a stroke, heart attack, or blood clot elsewhere in the body, even at a site distant from where the plaque originated. Another common cause of cardiovascular disease is arteriosclerosis, or hardening of the arteries, where blood vessels lose their elasticity. As the arteries have to adapt to changes in blood pressure from the heart beating and resting, a loss in elasticity means the cardiovascular system is less able to tolerate increases in blood volume that come along with things like physical activity or periods of great stress. This is one of the reasons why strenuous exercise can be dangerous for some people, because they have arteriosclerosis. Any narrowing or loss of elasticity in the blood vessels, or any scar tissue formed from lack of oxygen supply, means that the cardiovascular system is not able to function effectively. There are a variety of diagnostic tests that can diagnose CVD. While some are more invasive, expensive, and require specialized equipment and training, like electrocardiograms, which measure the electrical discharges coming from the heart, or coronary angioplasties, where dye is injected into the body so that x-rays can be used to reveal if there are any obstructions in the coronary arteries. A great indicator of cardiovascular disease is simply blood pressure, which can easily and usually freely be tested at your neighborhood pharmacy. Blood pressure is essentially indicating how much pressure is generated by the heart's contractions, as well as the pressure that's experienced between contractions of the heart when we're looking at blood vessel walls. Blood pressure can be elevated for a number of different reasons, including advancing age, with elevations that are more chronic and pervasive typically being indicative of cardiovascular disease. Hypertension is the label that we give to abnormally high blood pressure, and this is not something that individuals are very good at recognizing without an external diagnostic test. Hypertension is extremely important to monitor, as it is the single best predictor of heart attack and stroke, as it is indicative of atherosclerosis and arteriosclerosis. When atherosclerosis and arteriosclerosis, which often go hand in hand, are occurring, we must be concerned about a heart attack, or MI, myocardial infarction, which is the permanent death of heart muscle tissue in response to an interruption of blood and oxygen supply because the coronary arteries are obstructed or because blood can't get through. In less severe cases of MI, the heart may continue to pump blood, although it's pumping in a much, much less effective way. While in more extreme cases, the damage may be so severe the heart completely stops beating. Some of the characteristic symptoms of an MI would be feeling weak, dizzy, or nauseous, having trouble breathing, and having a sense of pain in your chest, shoulders, or maybe even in the jaw or back. One thing it's important to be aware of with MI is that the symptoms of a heart attack usually look slightly different for men than they do for women. So especially the pain in the arm thing is something that would be more often seen in men than women. So it's important to be aware of gender differences in terms of recognizing heart attacks. When an MI is experienced, some people lose consciousness, and obviously some people do die. Cardiovascular diseases are the #1 cause of death in the United States, and this is typically referring to heart attacks, though a little over 50% survive at least an initial heart attack. However, even if one survives, the heart is not able to regrow or repair itself, and the resulting scar tissue cannot function in the same way healthy tissue does. This really ends up limiting the type of physical activity or the types of stress that a person can safely engage in and endure. Another type of cardiovascular disease that is very problematic is a stroke. And this is actually a cerebrovascular accident or event that results in damage to the brain due to a lack of oxygen. The causal factors for a stroke are the exact same as the causal factors for coronary artery and coronary heart disease and for myocardial infarction, and these are atherosclerosis and arteriosclerosis. Just as these factors can affect the arteries that provide blood and oxygen to the heart, they can also affect the arteries that provide oxygen to the head and neck. When these arteries are obstructed, then this means that the brain is not getting the blood and the oxygen that it needs. And this oxygen deprivation can cause the death of brain tissue within a very short period of time, within 3 to 5 minutes. Stroke is the third most prevalent cause of death in the United States. To get a little more context about stroke, I'd like you to listen to a TED Talk. These are talks where famous individuals come and talk about their experiences, and related to research and talk about why these things are important. This TED Talk is by a neuroscientist who experienced a stroke herself, with her stroke actually being due to a slightly different cause than covered here, which was a brain aneurysm. But I think you'll find it very interesting because she was in some sense able to understand what was happening because of her great expertise in neurology. I'd like you to watch from 1 minute 40 seconds in the video up to 13 minutes and 30 seconds in the video. Note that when understanding the amount of damage that is caused by a stroke, it's related to the extent of total damage, but also to the location of damage within the brain and the function of those damaged neurons. Luckily, neurons are able to compensate for the death of some areas of the brain by taking on new functions that they didn't used to do before. And we actually also know from newer research that even adult brains can generate new neurons to some extent and under certain circumstances. The brain is able to recover, and with individuals who have undergone a stroke, we do typically see a fair amount of recovery in the weeks and months following the stroke, though the amount of recovery depends on the extent of damage done and the specific areas affected. Okay, now we're going to move to focusing on cancer, which are actually a set of diseases that represent the second leading cause of death in the United States. Then we'll consider both cardiovascular disease and cancer as chronic health conditions and consider their psychological and social implications. Cancer is one of the diseases that gets a lot of media attention, so I really doubt that any of you came into this course with a mistaken belief that cancer was not serious or concerning. When we talk about cancer, we just use that one term in the popular media, almost as if cancer is just one thing. However, I want to make sure you all understand that cancer is actually a set of diseases which have some things in common, but which also can have important differences from one another. The word cancer refers to a set of diseases in which new abnormal body cells multiply and spread beyond control, thus forming a tumor. All cancers share the similarity of having neoplastic tissue cells that undergo rapid and nearly unlimited growth that results in the host tissue being robbed of nutrients and which offer no beneficial effects. Certainly, when you think about a cell that's supposed to be a single cell that starts growing rapidly without any kinds of checks and balances, you can certainly understand why that would be problematic within the body, which is working typically in homeostasis with all the cells doing their own assigned function. Our bodily cells are designed to work in combination and in concert with one another, and when a cell starts to undergo this unlimited growth, it really impinges on the neighboring cells, and it may interfere with the function of whatever organ it may be part of or near to, so that's very problematic. Within the cancers, there are different kinds of tumors formed. Benign tumors are very localized and don't tend to spread throughout the whole body. In opposition, malignant tumors are those that invade and destroy surrounding tissues and may even move through the blood or the lymph tissue to other areas of the body in the process of metastasis. It's interesting to note that the discovery of cancer in one area of the body may actually be caused by cancer that originally formed in another area of the body due to metastasis. For example, cancer may originally be detected in the liver, but could have originated as breast cancer that spread. Due to our ability to examine the tumor tissue, healthcare professionals would be able to identify what type of tissue originally arose into cancer cells. If you have a tumor, you're certainly hoping to get the news that it's benign, because there's a very good chance that benign tumors will not be significantly problematic, while malignant tumors have a much worse prognosis because of their ability to destroy the tissue surrounding them and then move to other areas of the body, where they'll go through the same process of unchecked growth and damage to the tissue around them. Malignant tumors can affect epithelial cells that line the inner and outer surfaces of the body, the muscles, bones, and cartilage, or the blood and blood-producing systems, with some types of cancer being known to be more aggressive and difficult to eradicate than others. Here you'll see the percentage of new cancer cases, as well as cancer-related deaths due to cancer in specific regions or parts of the body. There's some really interesting pieces of information that we can gather by looking at this chart. For example, we'll see the types of cancer that are the most deadly, with lung cancer being the most deadly type of cancer for both genders. We can also notice from this chart that some of the most common types of cancer are not the most deadly. For example, breast cancer is the most common type of cancer in women, but it's not the most common cause of cancer-related deaths. Of course, there are reasons why some types of cancer are more deadly than others. Some forms of cancer are more aggressive, meaning they spread and multiply so quickly that there's a very small window of time in which to identify and treat them before the cancer has spread through the whole body and is negatively affecting multiple symptoms. Others are very difficult to identify. Still others affect systems of the body essential for life, such as the lungs, as in contrast to others that affect body parts that can be removed, such as skin or the breasts. A very prominent theory about cancer development right now is called the immune surveillance theory, and it suggests that cells of the immune system play an important role in monitoring, essentially searching out abnormal cells and destroying them. The basic idea here is that the body is constantly having cells that in their reproduction experience some type of a mutation in the DNA that might result in that cell not functioning properly and potentially undergoing the type of processes that would lead to growth at a rate faster than it should. In other words, our bodies have cells present within it at all times that have mutated and that have the potential to become cancerous. However, the idea of the immune surveillance theory is that our immune system is constantly on guard for these bodily cells that experience a mutation, and when it's able to detect them, it's able to destroy them, thus preventing the potential for those cells that are abnormal to become cancerous and form tumors. Recalling the basic idea of the diathesis stress model, there is some evidence that chronic stress can inhibit the immune system and reduce its ability to monitor for these abnormal cells and destroy them. Now that you have a better sense of what the cardiovascular diseases and cancer are, let's talk about what we know about risk factors for these diseases, at least in modern-day United States society. Interestingly, the rates of death from cardiovascular disease and cancer have both dropped, with rates dropping in the 1950s for CVD and the 1990s for cancer. So given that prevalence still remains at a problematic level for both sets of diseases, these can both really be conceptualized as chronic health conditions that individuals often end up living with for a long period of time and which must be managed. When considering these chronic health conditions, let's consider the risk factors for development, focusing on uncontrollable risk factors first. We know that advancing age is really the primary risk factor for cardiovascular disease, and the older people become, the greater their chances of developing and dying of cancer, period. So age is a very clear risk factor for both sets of diseases. Interestingly, the prevalence of different cancers actually varies by age group. So it's not true that older age equals the highest risk for all types of cancer, as some cancers are most prevalent in childhood or in earlier middle adulthood. For cardiovascular disease, for every 10-year increase in age, men and women seem to have about double the chances of dying of CVD. This significant association between age and cardiovascular disease is likely due to the accumulated impact of stress and of exertion over time. Another thing that plays a big role in both groups of diseases is family history. People who have CVD in their families are more likely to die of a cardiovascular disease or event than those who don't have such a family history. In regard to cancer, we know that genetics represents a diathesis for the development of certain types of cancer. For example, we know that individuals in families where there is the presence of breast cancer in 2 or more close relatives, especially when that cancer had an early onset, where breast cancer has been present in more than one generation, when there is a history of 1 or more family members having cancer in both breasts, where there's a family history of ovarian cancer, and when there is European ancestry, are more likely to develop breast cancer than individuals who do not have such a family history. However, we do know that certain cancers have more of a genetic or biological link than others. A mutation on a particular set of genes is particularly risky for the development of breast cancer, and individuals with a family history can be tested for the mutation. But those types of genetic mutations only account for, at most, 10% of breast cancer cases, meaning there are multiple other biological and environmental factors that play a role in breast cancer development. The biopsychosocial models of CVD and cancer generally follow the diathesis stress model, where the disease is being seen as triggered by a physiological vulnerability in conjunction with a variety of stressors in the person's life. In other words, this is conceptualizing an interaction between biological, psychological, and social factors. Gender is another uncontrollable risk factor that may impact upon CVD and cancer, which is primarily thought to relate to sex hormones. For example, the sex hormone testosterone, which is present in both sexes but to a much greater degree for males, is linked with things like aggressiveness, competitiveness, and other behaviors that may ultimately contribute to cardiovascular disease through activation of the sympathetic nervous system. And testosterone levels peak during early adulthood, which is when gender differences in cardiovascular-related mortality peak as well. When considering cancer, there are clear differences in prevalence and mortality based on gender in specific types of cancer, which may be related to sex hormones as well. For example, estrogen is present in both genders, but to a much greater degree in females, and seems to play an important role in the development of breast and ovarian cancers. It's also interesting to examine how the ethnic groups differ in terms of their risk. For example, we know that Asian Americans and Latin Americans are at a lower risk of cardiovascular disease than are Caucasian Americans, and that Caucasian Americans are at a lower risk of CVD than are African Americans. But this does not seem to be due to any kind of inherent genetic or biological factors. We know from the Human Genome Project that if you take any 2 random humans off the face of the earth, they're going to share 99.9% of their DNA. And the research suggests that even if there is a minute variability based on ethnic groups, that's not seeming to explain any differences in terms of risk factors for CVD. When considering cancer, we know that African Americans have the highest incidence rates for cancer in the United States, followed by Caucasian Americans, then Asian American, Native American, and Hispanic Americans. Again, this does not appear to be due to any underlying genetic or biological differences. Given that no biological differences are found to help understand these differing health outcomes by ethnic group, many people have contended that socioeconomic factors may be to blame, because we know that non-white individuals, on the average, tend to be of a lower socioeconomic status than whites, and that lower SES tends to be associated with behaviors such as eating a diet with higher fat, exercising less, smoking more, having less access to health care, and experiencing greater stress. Now, this isn't a perfect mapping of socioeconomic status onto ethnic groups, Certainly, the research tends to suggest differences in health outcomes based on race or ethnicity are due to psychosocial and economic factors as opposed to biological ones. As there is nothing personally that can be done about uncontrollable risk factors, though I always encourage you to be considering whether there are social policy decisions that could be helpful, let's start looking at the risk factors for cardiovascular disease and cancer that individuals can exert at least some amount of control over. As we know that men with the healthiest lifestyle had a life expectancy that was 9 years longer than other men in their same age group, we know that lifestyle factors play a very large role in ultimate health outcomes, including those related to cardiovascular disease and cancer. I want to start with screening behaviors and preventative care. For CVD, the primary screening one can engage in is simply to have blood pressure checked and monitored on a regular basis. For those who follow through with the recommendation for yearly doctor's checkups, this is usually accomplished in that visit, along with a check on standard lab work, which would also help identify if any problems are present. However, I do want to note that there do tend to be disparities in terms of education about cardiovascular disease. For example, while women tend to be very concerned with cancer, they are much more likely to die of cardiovascular disease than of breast cancer. Despite the fact that women are twice as likely as men to die following a heart attack or MI, men receive more aggressive diagnostic tests and more aggressive treatment procedures for CVD than women do. Also, women are less likely to recognize when they're having a heart attack. And in fact, even doctors and other healthcare professionals are less likely to suspect that a heart attack is occurring in a woman than they are in a man, because of the misconception of heart attacks as being a male disease. As cardiovascular disease is the single largest cause of death for women, and because heart attacks are more lethal for women than they are for men, education to both individual patients and to providers is needed to ensure the standard of care is equivalent across the genders, and that women are appropriately and effectively educated about their CVD risks and the need for monitoring and prevention. For cancer, engagement in screening behaviors is a much more complicated equation, as many types of cancer do not lead to symptoms that would arouse suspicion of cancer, at least early on in the disease, like stomach cancer, as well as the fact that some forms of cancer do not have research-based screening tests, like lung cancer, and that some forms of cancer screening require the recollection and the motivation to engage in them regularly without prompts to do so, like breast cancer, and that some of the cancer screening tests are uncomfortable and unpleasant to go through, like for colon cancer. In the case of both cardiovascular disease, and especially for cancer, early detection is key to prolonged survival and the need for less invasive and less distressing forms of treatment. As will likely come as a surprise to no one, diet is implicated in risk factors for cardiovascular disease and cancer in a number of ways. If one's diet promotes excessive weight gain or maintenance of a very high body weight over time, then obviously that's going to be problematic and is a risk factor for both CVD and cancer. Apart from weight alone, individuals who have a very high level of cholesterol in their circulatory system, especially low-density lipoproteins or LDL cholesterol, have a higher risk of developing cardiovascular disease and of mortality than individuals with lower levels of serum cholesterol. We also know that consuming a high level of sugar or eating simple sugars and carbohydrates rapidly in a short period of time, when done over and over again, can lead to damage to the system that regulates insulin and blood sugar, which puts them at greater risk of cardiovascular disease development. I thought you'd find this article interesting related to the impact of diet. Weight and dietary factors also play a role in the development of cancer, and diet is a primary factor in at least 1/3 of all cancer-related deaths. Higher body weight increases the risk for cancer pretty much across the board, while certain foods like red meat increase the risk for cancer, while an adequate intake of fruits and vegetables can be protective against cancer. It's possible that vitamin, mineral, and antioxidant intake that's what's responsible for the protective effects of eating fruits and vegetables, as vitamin A, vitamin C, the B vitamins, and certain minerals like selenium and calcium seem to protect against cancer. It's possible that eating whole foods is beneficial in part because many foods naturally have combinations of vitamins and minerals that make them work well together. For example, foods like kale, broccoli, soybeans, and almonds naturally have vitamin D and calcium together in a way that maximizes the use of calcium by the body. While most people agree that the benefits of vitamin use seem to outweigh any risks, certainly acquiring vitamins and minerals from your diet and natural sources is superior to supplementation. With only about 1/3 of United States adults being at a healthy body weight, the impact of diet and body weight are extremely concerning when considering long-term health impacts. On the whole, many individuals who develop chronic illnesses and diseases evidence substantial benefits once they make profound and lasting changes to the foods they eat. Of course, body weight is influenced by diet, but also by engagement in exercise and physical activity. Regular engagement in physical activity reduces the risk of cardiovascular disease, and low levels of physical activity have been associated with higher rates of multiple types of cancer. Substance use is also related to the risk of various chronic health conditions. Tobacco is implicated in 1 out of every 5 deaths in the United States, and this is the single most lethal carcinogen or cancer-causing substance. The risk for death by lung cancer for a smoker is 23 times the risk of death by lung cancer for a non-smoker, so this represents just an exponential increase in risk. We also know that smoking raises the risk of cardiovascular disease by about 2 or more times. The cellular damage done by tobacco use is not limited to just the respiratory system. Another risk factor for both CVD and cancer is excessive alcohol consumption. While there does appear to be some coronary or circulatory benefit of very moderate alcohol consumption, there are greater risks for the development of cancer as well as CVD associated with excessive drinking. For cancer, in animal models, drinking the equivalent of 2 to 4 alcoholic drinks per day increases the growth of existing tumors. So excessive alcohol use may influence outcomes once a tumor is already present. And the research supporting this link is not limited to just animal models. For example, we know that consuming 2 or more alcoholic drinks per day increases the risk of breast cancer by at least 25%. So certainly there's sufficient research to support that excessive consumption of alcohol is problematic in regards to cancer and CVD risk. And as you should know very well from our prior module, stress is another very significant factor when we consider the development of cancer and CVD, which should only be expected given that stress is inherent to the diathesis stress model. But let's break this down a little bit. For example, we know that education is negatively correlated with risk for cardiovascular disease, as is socioeconomic status. We don't have a definitive answer as to why this relationship exists, though most individuals theorize that this may be because these individuals are facing higher levels of stress related to lower income, less stability in housing, and may also be engaging in fewer health-promoting behaviors. We also know that having social support is something that is negatively correlated with cardiovascular disease risk, which may also boil down to experiencing less stress when sufficient and appropriate social support is present. Finally, lots of research has been done on the type A versus type B personality and its relationship with CVD risk. Type A personality is a label that's given to individuals who are competitive, tend to always be in a hurry, and who are hostile, who are compared to type B individuals who are more relaxed. Research has tended to suggest that individuals with type A personality, or who are more neurotic, do have various responses, especially in the face of stress, that make them have a higher risk for the development of CVD, especially with greater hostility and anger. For example, we know that 20% of fatal heart attacks occur in response to an acute angry outburst, and that the expression of anger and hostility are positively correlated to the severity of coronary artery blockage. In addition, a study found that people who scored the highest on an anger scale were 3 times more likely to have a heart attack than those individuals with the lowest scores. Interestingly, though, suppressed anger may be even more toxic to health than forcefully expressing anger. For example, individuals who ruminate, who hold their anger in, sort of dwell on it, who think on it over and over again, that may be even more predictive of cardiovascular disease than individuals who do yell and sort of express their hostility and anger. While stress definitely has a demonstrated effect on risk for cancer development and various cancer-related outcomes, some of the specific factors known to impact upon CVD risk, such as personality and social support, have not been shown to relate to cancer risk. It's possible this is because cancer seems to have a stronger impact from the environment than do some of the other diseases we talk about. The best estimate, based on research at this point in time, are that lifestyle exposures and factors are accounting for about 2/3 of all cancer-related deaths, which is really an important thing to appreciate because people tend to overestimate the impact of genetics on their risk for developing cancer. Interestingly, people also tend to attribute chances for developing cancer to random chance and other unavoidable factors like God's will, which is also important to appreciate as beliefs such as these really limit engagement in the types of preventative actions that would substantially lower the risk for developing cancer or treating it appropriately. These exposures can include those under voluntary control and those we may not even be aware of or cannot mitigate. One very concerning factor that I'll share with you is the fact that 40 to 50% of Americans who reach the age of 65 will develop skin cancer, a portion of whom will develop melanoma, which is a very serious and potentially deadly form of cancer. Risks for skin cancer seem to be related to both cumulative sun or radiation exposure, as well as a history of even just occasional sunburn, in the cases that sunburn has been severe, where it's led to water blisters or peeling of the skin. Some interesting facts about sun exposure, I think, are that individuals who have the deepest tans are more relaxed, but are more focused on their appearance than other individuals, and are more sensitive to peer influence from those who value the physical appearance of tanning and tan skin, who are least knowledgeable about skin cancer, and who tend to take other types of health-related risks. So certainly there are psychological factors that play a role in terms of those who are voluntarily submitting themselves to cumulative sun exposure. I thought it was interesting to put this image up because this shows that damage to skin cells is not usually apparent to the naked eye. When you look at the individual's straight picture of her skin, you don't see the damage, but when you look at it with special technology, you can actually visually capture the severity and the extent of sun-related damage. Now let's talk about some environmental risk factors for cancer that are not necessarily under one's voluntary or personal control. I'm going to pose a question to you first for your consideration. I have a list of professions: hairdresser, coal miner, chimney sweep, farmer, factory worker, and truck driver. And I'd like you to take a moment to consider which of these professions do you believe is related with a significantly higher risk of developing cancer than individuals that work in other occupations? So take a second to ponder on that. This answer may or may not surprise you, depending on how much you know about this topic, but the answer is that all of these professions share a significantly higher risk of cancer development than occupations in general, which seems to be most related to chemicals these individuals are exposed to in the course of their work. For example, hairdressers appear to be exposed to certain chemicals in hair dye, while farmers are exposed to high levels of pesticides used to prevent pests from eating crops and other farm-related chemicals. For factory workers, the cancer risk seems to be associated with exposure to wood or metal dust, while for truck drivers it seems to be exposure to diesel fuel exhaust. In general, when considering these environmental exposures, we often are all exposed to the problematic agents. For example, many of us breathe wood dust and have pesticides sprayed near our home or dye our hair. However, we're typically exposed to very small amounts of the potential carcinogens or cancer-causing agents, and thus don't experience negative outcomes such as cancer development. Of course, this can be more complicated than meets the eye at first glance. For example, pesticides that are used on crops are making their way into our bodies in small amounts, because very small amounts of residue remain on the foods we consume. The chemicals in hair dye may accumulate in the body if you've gone gray early and must dye your hair every 6 weeks to look your own age, like me. It may be that risks from these exposures can be cumulative in our bodies and build up over time, leading to cancer or other negative health outcomes, but that trying to trace any such diseases back to individual sources of exposure would be extremely difficult to do. We're not talking about cancer developing from eating one food at one moment. We're talking about influences that are accumulating and growing over time. So trying to single out one particular food or one particular chemical exposure, controlling for all other biological and behavior and environmental factors over decades, is obviously quite a daunting task and would require research that can investigate such exposures in extremely large groups of individuals or in individuals with higher levels of exposure to establish that something is carcinogenic, which, as I said, has been done. The risk for cancer or other negative health outcomes from environmental exposure is certainly one of the justifications for having the regulation of various industries from an outside body. The fact that manufacturing and other industries utilize toxic and potentially cancer-causing substances that can get into the ground, into our water, into foods that we eat, can be present on substances that we buy, in other words, are present and may expose us humans to the risk. This is one of the main reasons why businesses are regulated in terms of their pollution and environmental impact. However, there are still ongoing debates about how much regulation is needed. For example, for individuals working in manufacturing, exposure to silica dust, which is essentially sand, is known to cause silicosis. I have a link to a relatively recent NPR story about this, as there's a lot of ongoing debate about the regulations relating to how much silica exposure individuals who work in construction and manufacturing can face, versus the drawbacks of considering legislation that is more strict, which is a good representation of the types of dialogue, debate, and decisions that have to be made around a number of substances that may pose a cancer-causing risk. It's my sense that lots of students who have taken this course have found this information to be some of the most sort of scary, thought-provoking, and concerning information from the entire course. I think in large part because these are about risk factors that exist in the environment that you may not even know are risk factors and may have little to no control over your exposure to. It's impossible to try to reduce your risk if you're not aware of what can cause cancer or if you're powerless to limit your exposure to it. For example, artificial sweeteners such as saccharin or sweet and low and aspartame or equal have been shown in animal studies to increase the risk for cancer development when animals were exposed to very, very high doses of these substances. However, there's no human studies that seem to support this link, and it's unclear whether the findings of those animal studies would apply to humans' consumption of much, much smaller doses of the substance, but often over a more prolonged period of time. Thus, most organizations have put forth the stance that artificial sweetener use does not increase the risk for cancer. Of course, this conclusion is not based on a true experiment in human subjects. For many consumers, then, it remains unclear what the best course of action is to take if one is trying to be health conscious and minimize risk to potentially problematic chemicals, especially since we all recognize the dangers of excessive sugar consumption, which substances like sweet and low would be trying to reduce. One of the best ways that individual suffering can be prevented and money saved, as well as a very important role for health psychologists or allied mental health professionals, especially given how underappreciated this role is primary prevention, where we try to prevent problems from developing in the first place. Given that primary prevention is more effective and much cheaper and less time intensive than trying to treat problems once they've already developed, how do we encourage people to engage in behaviors to try to prevent the development of CVD and cancer? For both conditions, this would focus primarily on ways to minimize risk. For both cardiovascular disease and cancer, it's important that individuals lose weight, eat a healthier diet, and become more physically active. It's also really important that people discontinue tobacco use and reduce alcohol use to moderation. These are things that are common knowledge for the most part, but which many people really struggle with, especially with any kind of physical dependence to any substance, including sugar. Psychologists can be helpful by helping clients get more in touch with their motivation to make a change, help them create a specific goal and plan to meet the goal, anticipate barriers and problem-solve ways to deal with them, and help them stay accountable to themselves for making change. Involving a psychologist in a health behavior change plan can be extremely helpful, especially as individuals often minimize their own risks for developing any condition. They have an optimistic bias where they may understand the facts and figures about risks of various diseases, but they minimize how much risk they personally face and believe it will not happen to them. Because of this, individuals are less than receptive to preventative messages, whereas they may be more motivated to actually change behavior once a problem develops. Health psychologists can help bridge this gap in motivation so that hopefully a problem can be prevented from developing. Health psychologists can also help individuals manage stress better through the use of relaxation strategies, reinterpretation of experiences, or use of humor. This can lead to a reduction of hypertension, which may help reduce the development of CVD and help the body's immune system function better, which can help reduce the likelihood of developing cancer. Health psychologists can also be involved in programmatic or public policy development or decision making to try to use behavioral principles to affect individuals' motivation for engaging in healthy behaviors that may lead to a reduction in risk for CVD or cancer. For example, a psychologist may work with a large employer to offer a weight loss or smoking cessation program and provide incentives for participation. A psychologist could also work with an organization to look at the foods available to employees at work to ensure healthy options are very easily accessible, and perhaps even suggest that the healthiest of options be paid for in part by the employer, since it will likely save the company money in the long run if many employees shift their eating practices to include many more healthy foods. Health psychologists can also coordinate with politicians to help them consider things such as whether cigarettes should have a higher tax than is already in place, or whether a community should make a fitness facility free to all city or county residents. Once cardiovascular disease or cancer has developed, we have to shift efforts to secondary prevention, trying to identify the disease process early, and then tertiary prevention, treating the disease once it's fully manifested. As noted before, we want to identify problems like cancer and cardiovascular disease in their earliest stages because treatment is most effective and most cost-effective at that time. For cancer, we really have to focus on promoting cancer screening behaviors such as breast self-exams and colonoscopies. For CVD, we need to ensure people have access to primary care visits where lab work and blood pressure can be routinely monitored. Again, these intervention efforts may focus on providing accurate information and building knowledge or increasing a person's motivation to participate, or may focus on public policy such as healthcare access and health insurance coverage policies. If the illness is not identified in its early stages or continues to progress despite early detection, we then have to focus on the types of treatment available, which are, of course, disease-specific. For cardiovascular disease, there are a number of ways in which health professionals treat or manage CVD. One strategy very commonly used is the prescription of cardiac medications, which can affect the muscle rhythm of the heart, or the constriction of the blood vessels, or how easily blood clots. Another commonly used option is surgery, which typically takes a healthy piece of blood vessel and moves it to bypass an area that's blocked, providing a detour for the blood, or uses an inflatable catheter, almost like a small balloon, to sort of break up or compact the blockages in the artery so that the artery becomes more passable once again. This is primarily done in the blood vessels that feed the heart or the brain. Surgery can also involve placing a defibrillator on the heart so that an electrical shock can be provided if the heart stops beating or is beating very irregularly, or can even go so far as to replace a very damaged heart with a replacement one from a donor or with an artificial one. For cancer, there are a wide variety of treatment options available. If the cancer tumor is caught early enough and is in a localized area and hasn't spread, then surgery is often used if the surgery will not lead to damage to a vital organ or vital aspects of functioning. In some cases, cancer can essentially be determined to be cured if all of the cancer material has been removed, though some cancers are known to be very likely to recur. Chemotherapy and radiation are also commonly used to try to kill the tumor, shrink the tumor to the point that it becomes operable for removal, and or to try to prevent the tumor from growing or spreading to other areas of the body. Sometimes a patient's quality of life can improve dramatically if a cancer is contained or shrunk, even if the tumor is not able to be removed. Chemotherapy is the use of essentially toxic or poisonous medication to try to kill and prevent the reproduction of cancer cells. However, unfortunately, these medications also have negative effects on and damage healthy bodily tissue, so they tend to interfere with normal bodily function and tend to be extremely difficult treatments to tolerate, causing a host of very uncomfortable and distressing side effects. The specific type of chemotherapy used depends on the type of cancer present, of course. Now, radiation therapy uses X-rays or gamma rays to destroy malignant tumors and cancerous tissue. Surgery, chemotherapy, and radiation can all be used independently or in conjunction with one another. Sometimes these treatment approaches are also combined with immunotherapy, which is where medication is used to support or enhance the immune system's ability to selectively target cancer cells. Here's a really interesting recent article about the ongoing development of immunotherapy for cancer. It's important to recognize that none of these approaches to treatment is problem-free. For example, long-term survivors of cancer often report long-lasting fatigue, pain, sexual changes, and diminished cognitive functioning, and it can be unclear whether these long-term problems are due to the cancer disease process itself or due to the treatment that was provided or the stress that was caused by the process of being ill. Even if the cancer is deemed to be cured or remains in remission for a very long time, there are still aspects of being ill that remain and which strongly support viewing cancer as a chronic condition, especially with the high incidence of cancer recurrence. This may be part of why individuals have begun to turn their attention to alternative approaches to cancer treatment. In general, these alternative treatments like acupuncture, massage therapy, and dietary plans are unproven in terms of being able to cure or treat cancer, although many of these have been shown to help relieve symptoms. There does seem to be some interesting developments focused on the idea that certain foods are inherently inflammation producing, and that these foods are very problematic for individuals who have cancer because immunocompetence is reduced and thus the body cannot as effectively help itself in fighting against cancer. While there's less direct evidence in the notion that eating an anti-inflammatory diet will actually help prevent cancer, there are certainly large groups of people who believe this and try to structure their eating habits around it. As with any new ideas, it's possible research will bear fruit and lead to a significant shift in how we consider a disease process, or that the theory will fail to find empirical support and not lead to any changes in medical or clinical practice at all. Being diagnosed with and treated for CVD or cancer can be a very distressing experience. Developing anxiety in response to the development of cardiovascular disease and cancer is very normal, though sometimes people respond to their anxiety by limiting their activities even more than they need to for cardiac safety. Though, with CVD, some reduction in activity and stress tolerance is typically warranted as a natural consequence of having suffered an MI, for example. Being diagnosed with and battling cancer is also rife with distress. The diagnosis can raise a lot of fears about one's potential mortality, which is inherently challenging for a number of reasons. Thinking about and pondering on the implications of one's death for oneself from a personal and spiritual perspective, but also thinking about what that would mean for your family and other loved ones can be very problematic, and some people will go to great lengths to try to avoid confronting it. Coping with cancer is also difficult because of how distressing the treatments are, leading to things like extreme fatigue, extreme nausea, the loss of your hair, etc. Undergoing surgery for cancer can also elicit psychological distress, as it can lead to physical disfigurement or major changes in how the body functions, such as needing to use an ostomy bag. Being diagnosed and treated for some kind of cancers, such as breast cancer for women and prostate cancer for men, can also be problematic because they're likely to have sexual implications. I've had women tell me that they feel they lost their femininity or womanhood after having a hysterectomy, while men often discuss, quote, not feeling like a man if they lose the ability to maintain an erection due to cancer. I find it very interesting that a lot of women are actually choosing to undergo double mastectomy surgery, where the tissue of both breasts are removed to prevent any type of recurrence of breast cancer, even if they don't necessarily have to. And so I have a really interesting link about that phenomenon. While cancer and CVD are associated with significant distress, I want to be clear to say there are very low rates of symptoms that mimic post-traumatic stress disorder after the experience of diagnosis and treatment. Some individuals who go through a very distressing medical experience actually seem to experience post-traumatic growth, where they're able to see or perceive some benefits from receiving the diagnosis and undergoing treatment. Thus, while distress is present and can be quite intense, luckily it's usually not something that leads to long-term anxious and avoidant symptoms after being treated successfully. While these types of medical experiences are not necessarily meeting the threshold for trauma, given the distress that often accompanies the diagnosis of and treatment for CVD and cancer, how can health psychologists or allied health professionals offer help? There are a number of factors that seem to assist individuals with the ability to cope with diagnosis and treatment. One thing relates to the impact that health professionals can have, because it's been found that when patients receive accurate, informative, and timely procedural information regarding their treatment, they experience wide-ranging benefits, including fewer negative emotions, reduced feelings of pain, and even shorter hospital stays. I have a link to a really interesting recent research report which discusses the fact that a lot of individuals with terminal cancer mistakenly believe that they can be cured. And this suggests that there's obviously a deficit or sort of dysfunctional behavior on the part of healthcare professionals where they're not providing accurate information at the right time, and or that the cancer patients are perhaps not able to hear or take in that information in a meaningful way. Psychologists can help medical professionals learn to communicate more effectively, and it can help ensure patients are able to understand their diagnoses and treatment options in regard to decisional capacity, and can help them process their reactions to these factors. This is really important because patients should have the right to make choices about their own health care. If a patient understood that there was no hope for recovery, for example, they may opt for care that focuses more on their comfort and well-being rather than trying to continue treating the cancer per se, especially given the very uncomfortable and distressing side effects such treatment has. Health psychologists can also help patients cope with their stress more effectively by helping them disclose and discuss their emotions, develop or elicit the kind of social support that will be most meaningful at that time, gather needed factual information to inform decisions, examine interpretations of ongoing experiences to ensure or target biases that may be fostering anxiety, hostility, or depression, or use mindfulness meditation or relaxation strategies to try to promote parasympathetic nervous system activation. Relaxation strategies can be particularly important in the face of active treatment, given how distressing undergoing surgery or receiving chemotherapy can be. For example, some individuals find that when they practice relaxation during and after receiving a course of chemotherapy, it reduces their nausea, because nausea can be worsened by sympathetic nervous system arousal. There's also data that interventions such as these can actually improve immune functioning, which is key for these types of diseases. These types of interventions can also promote more effective and healthy behavior. For example, if someone has the belief cancer is a death sentence, they may feel very depressed and hopeless, and may skip chemotherapy appointments even if the cancer they have is highly treatable. For cancer, there are also some additional specific treatment strategies that can be used to try to minimize the very negative side effects of treatment. For example, classical conditioning can sometimes be used to help people avoid food aversion. After undergoing chemotherapy, nausea is a very common reaction, and when individuals pair the experience of nausea with, for example, their favorite food, they may develop an aversion to that food, such that even just thinking about that food makes them feel kind of queasy. A health psychologist could help such a patient avoid this aversion to preferred foods by having individuals eat foods that they don't typically enjoy in that sensitive period of time prior to and immediately after undergoing a round of chemotherapy, so that they associate the nausea with foods that they already don't particularly like, so that they can better continue to enjoy the foods that they do like. I hope you enjoyed learning more about these bodily systems, the common illnesses of them, and the ways in which health psychologists can be involved in helping to prevent these diseases and treat individuals once they develop. Again, you'll hear more from me in our next module.